So we are here today to talk about pronouns, what they are and why do they matter. And this is it's quite a hot topic in general. It's a hot topic for most people. Any time that we're talking about EDI issues, so EDI being equality, diversity and inclusion, sometimes known as DEI, so diversity, equality and inclusion. Whenever we're talking about that, the topic of pronouns is one that comes up, and it's probably something that you have seen a lot. You might perhaps be increasingly aware that pronouns are being asked for in various circumstances. And so that's what we're going to be talking about today is pronouns, and in particular, their relevance to patient care. So for someone like myself as a practicing chiropractor, how do pronouns and the use of pronouns play out in my clinic? Why do they matter? Why am I concerned about them? And what should we know about them when we're considering patient care? So my name, to introduce myself properly, my name is Philippa Oakley. I use she, her and her pronouns, hers pronouns. And this is my family. So I thought I'd put a little picture up there. This is my wife, Rhiannon, on the left, and our daughter, Clover, in the middle. She is almost 3. I won't tell you how old we are. But we are a family. As I mentioned, I'm a practicing chiropractor. I've also worked in the past in the NHS with any qualified provider contracts. And I do a lot of work when I'm not in clinical practice. I practice clinically for 2 days a week. When I'm not in practice, we run a consultancy, which is Oakley Partnership, where we deliver training to the NHS, UK healthcare associations, membership organisations, and I do a lot of work with the GCC as well, so our UK healthcare regulators. So we're doing a lot of work with them on EDI. So looking at the best practice for EDI, looking at what we should be doing largely as a chiropractic profession, but also as a healthcare field in general. So what we should care about, what we need to be aware of, what we should be thinking about with our clinics. And we work as well with individual practices, looking at their clinic policies, looking at their processes, and identifying any issues, any potential areas of concern, any potential areas where you might encounter a problem with your patients, and also just helping with what can feel like a bit of a minefield for a lot of people. And I think it's really important to bear that in mind, that actually pronouns are something. Even when I started talking about running this event, I had a lot of comments from people saying, I'm trying really hard not to be concerned about pronouns, or I don't care about pronouns. They're not relevant to me. I just want to care for my patients and I want to treat them well. And I think that there's understandably a lot of concern around pronouns because it feels very clunky. When we start talking about somebody and using terms like they, them, somebody who is as a singular person using a they, them pronoun, as a native English speaker, that can sometimes feel a little bit unfamiliar to us. And that's where a lot of the challenges lie. So if we have a little look at the history of pronouns, come on, computer, move on. There we go. So what is a pronoun? A pronoun is a word that we use to refer to somebody when we're not talking directly to them. So when you're in a conversation and you're talking about your friend Alice, who isn't there, you might say, oh yeah, Alice, she has a meeting today and that's why she's not here. So that's the pronoun there is she, her, hers. Increasingly, we see people who are using neopronouns. So neo comes from the Latin for new. So it is a new type of pronoun that somebody's using. I'm trying to pronounce my N's well, but as I said, I've got a bit of a blocked nose, so it might be coming across a bit oddly today. But pronouns are used to indicate gender, particularly in the English language. We use she, her, he, they, them. Those are the pronouns that we use. And the she and he pronouns in particular have gendered implications. Now, one of the biggest arguments against pronouns is actually that they're a modern phenomenon. And they're not. So you might be wondering why I have pictures of Geoffrey Chaucer, William Shakespeare, and Jane Austen down on the bottom, and you're thinking, surely they're lost. They are not. So actually, to take you back a little bit, English, in gender-neutral English, like a gender-neutral language like English, we use the word they to use as a singular group of people or to use about one person in particular. So we might say, oh, Alice, they've just popped to the shops, for talking about our friend Alice. But when they first appeared in the English language, it was actually borrowed from a different language entirely, and we adopted it into the English language. Now, originally, the use of the word they was used as an alternative to he, which is where in Old English stories, so like Geoffrey Chaucer with the Canterbury Tales, you would see the word they popping up and you might think that it's a replacement for he, but actually there's no indication that it was. So what we did was we used the word they to fill in a gap where we didn't know a person's gender. And that's what we should really think about when we think about the word, the pronoun they now. We use it now to fill in a gap when we don't know somebody's gender. So when somebody is gender fluid nowadays, this modern phenomenon that we talk about, which isn't a modern phenomenon, when we're talking about somebody who is gender fluid and they use the word they as their pronouns, that they stands in place to denote that we don't know what their gender is. And it's really important when we're talking about somebody, who might be gender non-binary or might be gender fluid, that we don't use a pronoun that we don't know is assigned to them. So we don't misgender somebody by saying Alice uses she pronouns because we don't know what pronouns Alice uses. Another of the arguments against pronouns, and I shouldn't talk exclusively about the arguments against pronouns, but I think it's sometimes easier to talk about the challenges around integrating pronouns rather than it is to talk about the reasons why we should be using them, because I think predominantly, and I'm hoping if you're here, it's because you recognise that it's important to use these pronouns and that you're keen to learn more about them. So for a lot of people, and I was talking to somebody recently in a group who is not a native English speaker, and they said it's really confusing and it's really difficult to use these pronouns, particularly if English is already your second language. But actually, when we look at Romance languages, so when we look at languages like Spanish or Italian, and we look at other languages like Hebrew and Arabic, those are what are called gendered languages. So actually, they use a word in front of a noun to denote what that word is, and often a masculine variant of that word is the assumption. So you would find in Spanish, for example, that they would say bienvenido, for example. So they'd say bienvenido, and having an O on the end of the word denotes that it's a masculine word. So you also get things like el teatro, for example, the theatre. El is masculine, so they have a lot of words in the Spanish language that are already masculinized. And so we have this challenge for people who use those languages, for whom, as an example, Spanish is their native language, where they are very, very used to having a pronoun and a noun, and the two go together, and they are masculine or feminine. In the English language, we don't really have that. For example, our nouns like table, door, refrigerator, we just use the noun in and of itself. It doesn't have el table, for example, in front of it. El table, I don't think that's the actual Spanish word for table. El mesa, la mesa, there you go, Spanish. So in Spanish, a table is female because it's la mesa. We don't have female or male tables in the English language. And so actually, the English language is one of the ones where it's perhaps easier in many ways to start adopting pronouns and to use them, because we don't have to worry about whether we're referring to a word that is already masculinized, like teatro, for example. So the way that a lot of people who are native Spanish speakers, native Italian speakers are getting around those is by using a different expression entirely. So they're finding it quite challenging to adopt pronouns or to adopt genderless language in those countries. And so instead of saying things like bienvenido or bienvenida, they're saying words like le damos la bienvenida. So they're saying we welcome you instead of bienvenido or bienvenida. So that's how they're getting around it in those countries. But it is something that is challenging, and I think it's really relevant for us to be aware of that. If we are working, as I do, I have a lot of patients who aren't native English speakers. I work in an area where it's very heavily a military area around here, and so we've had a lot of people who've come in from abroad, and so we have a very, very diverse population around where I am. And so it's important to be aware of this, because if I've got a patient who is a native Spanish speaker, for example, they might really struggle with adopting a genderless pronoun to use when they're referring to another person. So that was your nice little whistle-stop tour of Geoffrey Chaucer and the Canterbury Tales and what Pride and Prejudice have got to do with pronouns. So when we talk about pronouns, another thing that people will often say to me is that it doesn't really matter. Do I really need to be concerned about pronouns? Do I really need to worry about this? Can't we all just get along? Now, pronouns, misgendering people, they have a direct impact on our patients' experiences of care. And this is where it becomes enormously relevant for me as a practicing chiropractor. I found a little video that explains it a little better than I could, or perhaps more concisely than I could. So I'm going to hope that this works. And let's see. Oh, come on, computer. It's just going to skip on to the next slide. Oh, that's annoying. Okay. I will share you the link with the video earlier. It worked earlier, but I'm now using my wife's computer, so I'll blame her for it. But I'll talk you through the reason why microaggressions are relevant. And this video, it's only a minute long, but it does a fantastic job of explaining microaggressions and their impact on somebody's experience of the world being similar to a mosquito bite. So mosquito bites, I'll basically be able to tell you what the video says. But if we think of a mosquito bite, it's one of the most annoying things that you can experience. So you're just walking along on a hot summer's day, and then suddenly you notice that your arm is itching, and you look down, you've got an absolutely giant mosquito bite, and you might scratch it and think, oh, that's a bit of a nuisance. And then it annoys you for a couple of days afterwards, and eventually it goes away. Now, some people experience more mosquito bites than others. When we talk about some people experiencing more mosquito bites than others, I'm of course talking about microaggressions as a mosquito bite. So a microaggression is saying something like to this lovely black lady on the screen in front of us and saying, oh, can I touch your hair? Where are you from originally? That is a microaggression. And we do experience them in clinical practice. And we do know, as those of you who saw my presentation with Fadine at the BCA conference, we do know that we have challenges with this within the chiropractic profession and within the wider healthcare field itself. We do have issues with practitioners in clinical practice who are experiencing microaggressions. So saying to somebody who is in a same-sex marriage, or for example, making a heteronormative assumption, that's what I often encounter in my daily life, is somebody saying, what does your husband do? It's not necessarily intended to be unpleasant. It's not intended to be discriminatory. It's not intended to be cruel in any way. But it is a microaggression because it is a heteronormative assumption. We live in a society where it's very, very geared up to cisgendered heteronormativity. So the assumption is that everybody's gender aligns with the sex that they're assigned at birth. And the assumption is that most people are in a heterosexual relationship, so a man married to a woman. And so a microaggression as a mosquito bite, you might experience one throughout your summer. You might have one mosquito bite that you struggle with. Somebody who is a member of a marginalized community, so for example, this black lady, she might experience 4 or 5 microaggressions within a day. That very quickly, that one mosquito bite escalating into 4 or 5 very quickly becomes something that is enormously frustrating, really difficult to switch off from, and becomes really, really impactful on their daily life. Not to mention the fact that actually microaggressions can lead to very, very severe problems. So in this video, they show a lovely example of a student who is going for career counselling, and it's a black student, or I think it might be a Hispanic student. And the career counsellor says, oh, you want to go into law? Perhaps you should look for something that's less challenging. We also see then the impact that has on that person's life. So they then don't pursue their law degree. Perhaps they go and they find something that is less challenging. And as a result, they have a lower socioeconomic status. They have lower earning potential. They have a lower level of education, all because of one comment that somebody said that cast doubt in their mind and impacted their life trajectory going forwards. We then, of course, see, and perhaps living in the UK, we're lucky that we don't see as much of this as our colleagues over the pond. But if we take what happened with George Floyd, I know perhaps this is something that is more to do with racial microaggressions. But if we look at the nightclub attacks, for example, that they had over there, the nightclub attacks. When somebody says they looked shifty, or I thought that gay guy was coming on to me, those are instances where in America, people have been shot for lesser things. Young black men in America have been shot just because somebody thought that they looked shifty. Somebody thought that they looked out of place. And so microaggressions do have a very real impact on people's health outcomes and health trajectories. Now, when we talk about the LGBTQ plus community, this is a community that is already at significantly higher risk of tobacco, alcohol, and drug misuse. We know that they're at higher risk of sexually transmitted diseases. We know that they're at higher risk of psychological distress. We know that they are more likely to have experienced adverse childhood events, so ACEs, you might be familiar with those. We also know that in transgender youth, for example, we have a serious issue with suicidality and suicidal ideation, where we have around 30% of transgender youth in the UK who will have attempted suicide at least once. So they are the LGBTQ plus community are a group that is heavily marginalized and are very heightened risk of discrimination, rejection, and violence. So this is something that you really do need to be conscious of when you are working with these groups. It's not just about being aware of the fact that your patient is in a same-sex marriage, for example. It's about being aware of their background and how that impacts them. So if you are talking to a patient who is a member of the LGBTQ plus community, you can be aware that you are already dealing with somebody or speaking to somebody who is perhaps at heightened risk of alcohol and tobacco misuse, for example. They might have had an overall poorer experience with the healthcare community. They are significantly less likely to seek help. If any of you have done our LGBTQ plus course, you will be aware that this is a community who are increasingly less likely to seek help from medical providers because they are so likely to have had a really poor experience with the healthcare community. We have videos within that course from people who are gender non-binary who talk about the fact that they will not go and see a medical provider if they do not know that they are trans inclusive and that they have specialist training in LGBTQ plus inclusive care, purely because they experience discrimination, they experience challenges with receiving onward referrals, and quite often somebody who's a member of the LGBTQ plus community will go and see their GP. And if we're talking about a transgender person in particular, a transgender person quite often will present to their GP and say, I'm considering transitioning my gender and I want to receive gender affirming care. And the first referral that is put in place is a referral to CAMS. So it's a referral for mental health services. That's an inappropriate referral. That doesn't need to happen, and that's not how it should happen. But we are already talking about pathologizing somebody who is gender non-binary. We are saying you have a medical condition, you have a mental health disorder, and I'm going to refer you to a mental health practitioner before I refer you on the pathway to receive gender affirming care. I cannot think of any other medical condition or any other mental health disorder that requires medical treatment where we would say, we're going to send you to a mental health provider before we do anything else. It might happen in conjunction if that person also has suicidal ideation, for example, and that would be appropriate, but it's not appropriate for that to be the first and only referral. So these are the type of microaggressions that this community are experiencing. Now, if we are talking about somebody who uses a neopronoun, so who uses a pronoun like they, them, for example, if we make an assumption as to that patient's sexuality and their gender, it could stop them from receiving referral onto appropriate health services. One of the biggest challenges that we see within the LGBTQ plus community are things like cancer screening. For example, there's a myth in the lesbian community, for example, that we don't need to go through smear tests because we're not having sex with men. And that's not true, but you would be surprised the amount of medical practitioners who believe that myth as well. Now, if we are talking to somebody who is a transgender male, so they were assigned a female at birth and they've transitioned to male, the vast majority of transgender males will retain at least some of their natal organs. So a lot of them have retained their cervix. Now, if we have a patient who presents to our clinic and they are a transmasculine patient, they use he, him pronouns, we might then fail to ask them when the date of their last smear test was. And so we can miss the possibility of them having endometriosis, of them having polycystic ovaries, I don't need to tell you about all of the healthcare conditions that we need to be aware of in a menstruating patient who has a uterus, but these are the kind of things that we need to think about when we're talking about patients who use pronouns and their impact on healthcare. Sorry, patients who use pronouns. Everybody uses pronouns, but when we talk about gender non-binary or transgender patients who are using neopronouns, this is why it's relevant. This is why all of this is relevant. And pronouns are a very small part of LGBTQ plus inclusive care, but it's a very, very important one. We see this trend emerging as well in mental health care settings as well. So in a study back from 2014, around half of clients who'd been to see a counsellor who were from a minoritized group reported that they had been subject to microaggressions from their therapist. So somebody has gone to see a counsellor and that counsellor has in turn used a microaggression on them. This perception of microaggressions or the experience of microaggressions correlated really significantly with their satisfaction with the care that they received and their relationship with their therapist. So it seriously impacts the relationship that we can build with our patients. Now, on my other hat, doing a lot of training on patient communication skills and motivational interviewing, the patient relationship and patient-centered care is just paramount to having a successful outcome from treatment. So if we are immediately misgendering a patient or using the wrong pronoun when we first meet them, that's going to set us up for challenges further down the line in our patient interactions. We've got separate studies as well from places like the Journal of Behavioral Medicine and the Psychological Bulletin looking at the impact of microaggressions and pronouns on physical conditions and discrimination. So these microaggressions, these mosquito bites that we were talking about, are a known stressor and they're known to have a negative impact on health, particularly cardiovascular health. So patients who report experiencing more microaggressions throughout their day are correlated with having hypertension, cardiovascular disease, raised heart rate, and increased cortisol secretion. So again, enormously relevant for me as a practitioner, looking at a patient who's got an elevated heart rate. Are they going to be on statins? What kind of medication are they taking? We know that statins have a link with muscle pain, as well as the impact of cortisol as a hormone circulating in somebody's body and what that's going to do to their response from care, what that's going to do to their overall health in general. From a mental health perspective, microaggressions, misgendering, using the wrong pronouns, they are linked with anxiety, depression, a negative view of the world, low locus of control or poor locus of control, heightened stress, and poor sleep, and in particular, deep wave sleep. So that really, really restful sleep. So this community, the LGBTQ plus community in particular, which is what we're talking about today, but to talk about the broader EDI impacts of this, somebody who is a member of a marginalized community is substantially more likely to have worse health outcomes than somebody who is not a member of a marginalized community. So again, enormously relevant to any of us working in clinical practice. And these are things that we need to be talking about with our patients and that we need to be addressing. And it's not as simple as it might be working with somebody who isn't a member of a marginalized group or who isn't from a marginalized community, because it's not as simple to say to somebody, put down your phone 2 hours before bed and, try to switch off and get a bit more sleep. If you're talking to somebody who's experienced repeated microaggressions throughout the day, throughout the week, throughout their life, it's a systemic issue. It's perhaps much bigger than one person, one chiropractor can manage on their own, but it's definitely something that we want to be aware of and that we want to at least be addressing. I have a lovely, lovely patient who is, she is a Black lady. She's got 3 kids. She uses they, them pronouns. She has been on the waiting list. She uses she, her, they, them pronouns. And this week she was using she pronouns. So I saw her yesterday and we're on she this week. And that's important as well. And I'll come to that in a minute, but it's a very fluid thing. So you have to be keeping on top of it. But she was talking about her experiences with healthcare and the amount of times she has gone to a healthcare provider and she's been told that her problems are due to her being overweight. They are due to the fact that she's not sleeping well enough. She's been on the referral list for a simple gynecological procedure for over 18 months. She should have been seen within a 12-month period. And a lot of this is to do with the fact that she was slow to attend a healthcare provider in the first place. She had a really poor experience with a healthcare provider. And so it took a lot of gentle coaxing to encourage her back to try and push that referral forward. So It's really, really rewarding when you're working with these patients and you get it right and you can help them and you can talk to them about not just their experiences with you, but also how they can communicate more effectively with other healthcare providers. One of the things that I do with a lot of my patients who use the neopronouns, sorry, just have a big sniff, try and sort it out, who uses neopronouns, is to talk to them about how they can better improve the way that they communicate with other healthcare professionals. So giving them guidance on how they can, in effect, prevent being misgendered in a medical environment. It's really unfortunate that we have to put these safeguards in place already. It's really disappointing that I have to say to people, hey, let's put things in place so that you're protected in advance. It would be nice if they didn't need that protection, but it's something that we can do. So I can encourage them to say, well, hey, you know, you've got this little badge on your rucksack that you're wearing today that says they, them. Why don't you carry that with you? You know, why don't you make sure that you've got that with you? So you're wearing this little badge. You know, I've got a lovely patient and they have a rucksack where they have loads of those little badges with little slogans on them and things like that. And I said, hey, why don't you just put the one that says they, them on there and hope that somebody notices? You know, it's something that they can wear that can give them a little bit of confidence that somebody might pick up on that and use the correct pronoun when they're talking to them. We can also encourage them and say, if you're going to a new healthcare provider, if you're going to a new dentist, as an example, write the dentist a letter and say, I use they, them pronouns. We have a lot of practices around here that haven't yet adopted inclusive intake forms. It's something that I notice a lot, perhaps just because of what I do, but also coming from a same-sex family. It's something that we're very, very aware of and that we're perhaps more attuned to than the average person. And saying that as a member of the LGBTQ plus community and saying this to you as healthcare providers, I look for that in healthcare providers as well. And your LGBTQ plus patients will be looking for that from your clinic as well. So we do need to think about the way that we are talking to our patients, the signposting that we're putting in place, and the opportunities that we're giving them to tell us what their pronouns are to help safeguard them against having to be in a potentially embarrassing or awkward situation. So just move on. Found there's a lot of research coming out in this area, but we have found substantial and significant links between affirming pronoun use, so using somebody's correct pronouns, and them having positive mental health outcomes. Patients who feel seen and acknowledged in their gender identity and the gender identity that they are presenting with at the time of their appointment, their consultation with you, are substantially more likely to engage and take an active part in their healthcare journey. That's going to lead to improved mental well-being, and as a chiropractor, that's going to lead to enhanced compliance with care. It's going to lead to a better patient-practitioner relationship, and hopefully going to result in improved outcomes from care as well. So these are all things that I want to be thinking about when I'm dealing with my patients, when I'm talking to them, and making sure that I use the correct pronoun with them, because it has such substantial links with their outcomes from care. Now, in transgender youth, for example, when transgender youths are allowed to use the name that they feel that they align more closely with, not just their pronoun, but if they perhaps have a chosen name that they want to use, that is associated with lower depression, decreased suicidal ideation, and decreased suicidal behaviour. So again, when I talk to practitioners and they say, you know, we don't really need to care about LGBTQ plus inclusive care, it doesn't happen very often, but it does happen. And particularly when we are talking to government groups, when we are lobbying, when we're doing work with the NHS, there is a lot of disinvestment happening in EDI at the moment. So a lot of organisations are pulling back from EDI efforts, and they're saying, we don't need to worry about this because we have got 20,000 preventable cancer deaths in the UK. The two can exist, coincide, and both be true. Yes, we need more work on cancer funding. Yes, we also need to be doing more work on EDI. It's not an either or situation. We have a lot of issues within the healthcare system in the UK, but actually this is one area that we do still very much need to focus on. When somebody says to me, LGBTQ plus inclusive care isn't as important because it's not life or death, it is. It is. We have 30% of transgender youth attempting suicide in the UK. So that is a life or death situation. I know of at least 3 people who unfortunately have lost their lives to suicide because of being transgender, and the issues, the challenges, the impact that had on their lives. And so it matters. It matters to your patients, and it matters in a wider healthcare context as well. When we talk about utilising correct pronouns with our patients, this isn't just a tick box exercise, and that's what I'm really trying to get across today, which is why this is taking quite a broad conversation around pronouns. But when we talk about using the correct pronouns, it's not just about ticking a box. It's not just about having an opportunity in your intake forms for your patients to write what their pronouns are. It's about making sure that all of our care, the care that we provide to that patient, is tailored to their unique needs. So if I have a patient who is using they, them pronouns, or using ze pronouns, or using another kind of neo-pronoun, I know that that person is potentially gender non-binary. So I'm thinking about all those things that we've already talked about today. I'm thinking about as I'm having this interaction with them, as we're talking, as we're taking a clinical history, I'm thinking about this patient is probably more likely to have mental health concerns. What's that going to be doing to their start back risk of chronicity, for example? They're more likely to have fear avoidance beliefs. They might be catastrophizing. They might have depressive thoughts. They might really struggle with compliance with an exercise program. They might also already have underlying health conditions. So we know that LGBTQ plus people tend to present substantially later in the pathology of their condition because they are less likely to seek care. So they tend to present with more advanced disease than somebody who is a cisgender heterosexual. So I know that with that community, I need to be very aware of asking questions about whether they've attended for cancer screening, whether they're engaging in risky lifestyle behavior, such as drug use, such as smoking, such as alcohol abuse. I need to think about their family support network. In the LGBTQ plus community, we have a lot of people who have what's called a chosen family. So somebody who's come out as transgender, who is using they, them pronouns, who is genderqueer or gender fluid. Are they still in touch with their family, or has that impacted their family relationship? Where are they living? Do they have a safe home environment? Unfortunately, as you've probably gathered, if you're thinking about somebody who is, a transgender youth who's been kicked out of home, who is sleeping on a friend's couch, they're probably not going to be able to hold down a job. And so, unfortunately, for somebody working in private healthcare, it presents challenges with them being able to afford care. And so that feeds into this system. They're less likely to be able to afford care. They're less likely to be able to access care. They're more likely to present with an advanced stage of their disease. And so they're more likely to have poorer health outcomes. So it all plays into this really unpleasant cocktail of the experiences that your LGBTQ plus community and your LGBTQ plus patients might be having with their healthcare providers. And we have a real responsibility as healthcare providers to create an inclusive environment for our patients. Particularly, I always feel, as somebody who is working in private healthcare, if my patients are paying money to come and see me, I want to make sure that they are getting the very best experience possible. And so it's not just about knowing what somebody's pronouns are and using their pronouns. It's about their experiences with you. It's about their experience with the practice. And as I mentioned earlier, my friend George, who recorded a video for our LGBTQ plus inclusive course that we have, the LGBTQ plus community talk. And this is what George puts across so well in their video, is they were explaining that not only would they not go and see a healthcare provider if they didn't know that they were LGBTQ plus inclusive, but they also talk to their friends. And I have one of my wife's ex-bosses actually is Ray and uses they, them pronouns. So Ray was assigned female at birth and has transitioned and is a transmasculine patient now. And Ray was talking about the fact that when Ray was trying to look for top surgery in the UK, there is an Excel database that is shared amongst the community of inclusive GPs, of inclusive surgeons, of inclusive counsellors. There's literally Excel databases that are circulating within the community. I know I want my name to be on those databases. I want people to feel comfortable coming to me and to know that I am aware and able to provide them with the appropriate healthcare that they need. And pronouns are one tiny aspect of that, but it's perhaps one of the simplest things that we can do that would help with that. if you think of a pronoun as a gateway to understanding your patients, as a gateway to understanding their needs and being able to afford to provide them with appropriate healthcare, that's where we recognize the power of a pronoun. So how do we ask about pronouns? So I see a lot of, I have many thoughts on this, which I'll share with you, but it can be incredibly dysphoric for somebody who is suffering with gender dysphoria. So somebody who is living in a body where it doesn't meet with their gender identity. So somebody who identifies as female, who is living in a man's body, it can be incredibly dysphoric to say, to come into a clinic and have somebody say, what pronouns do you use? So if somebody is non-binary, so somebody doesn't identify as either male or female, but isn't passing, as in their gender expression isn't clear to the people around them, the type of person where we've all done it, if you've looked and said, is that a man, is that a woman? I don't know. That's somebody who perhaps isn't passing. It can be incredibly triggering, incredibly distressing, and incredibly dysphoric for them to be asked, what pronouns do you use? And it can be very, very embarrassing. If they are coming into a busy waiting area and your receptionist very kindly, very well-intentioned said, what pronouns do you use? That can be mortifying. It's like the experiences that we have for example, my wife and myself signing our daughter up for her new school, and the forms say mother's name and father's name, and we have to go up to the reception and say, she's got two mummies. And it's embarrassing, it's horrible, but we also shouldn't have to do it. And then you find that you end up apologizing and saying, oh, I'm really sorry to cause problems, and I'm sorry that I'm asking you to change this form for me, but actually we could just have parent 1 and parent 2 on these forms, for example. So I have a real issue with asking about pronouns, in that I often wonder if we even need to ask. If a patient isn't forthcoming with their pronouns, I assume they, them. It's the same if I have a female patient on my bench and they talk about their partner. I always assume the partner is they, them until I'm told otherwise, until I'm explicitly told otherwise. A lot of people would ask and say, what are your preferred pronouns? And the challenge with that question, and there's a big debate about this, but the challenge around asking somebody their preferred pronouns is, does that give the impression that it's perhaps optional? I know for me, being referred to as she, her is not optional. Those are my pronouns, and I identify as cisgender. So I identify as a woman, as female. My gender identity matches the sex that I was assigned at birth. So if somebody referred to me as they, them, or zir, I would say that would be misgendering to me. And so it's something where you think, actually, do we have to ask these questions? Do we have to ask if they are a preferred pronoun, or could we just say, what are your pronouns? The example that we've got on the right-hand side is from my intake forms. I use JNAP, and JNAP unfortunately asks about preferred name. I've thought long and hard about this, and I actually think that preferred name is probably acceptable because, for example, my mum's name is Janice, but she would absolutely spit chips if you called her Janice. So her preferred name is Jan. So for many patients who are cisgender heterosexual, they probably do already have a preferred name. I've got an aunt whose name is Margaret, but she goes by Peggy, so that's her preferred name. But I think pronouns is a different thing. You will also notice on this box, Jane, I think, have put a lot of work into this, and they have their example in the box is they, them, for example. So they're already opening the door for people who use neopronouns to say, hey, it's okay for you to put your pronouns here. This also has the added benefit of signposting to those patients and saying, we're a clinic where we ask about pronouns. We're going to give you an opportunity to tell us what your pronouns are if you want to, and we will then use and respect those pronouns. So that's one way to do it. And it's also really helpful because it normalizes it. And for patients who are within the LGBTQ plus community, who are potentially on your website, who are checking out your booking forms, it's one way of signposting them to say, hey, we're an inclusive clinic and you are safe in our hands. I often think it's useful to normalize it with staff as well. So can your staff use their pronouns? If you have name badges out in reception on the desk or anything, could you put pronouns on there? Do you have your pronouns on your website under your practitioner names, for example? When we talk about pronouns and we talk about neopronouns, and I've put some examples here of neopronouns and how they might be used in clinical practice. So situations where you might need to know, how do I use that in a sentence, or, what does it mean? Also on a note, the ZZ here and the Z, Zem, Z, they sound very, very similar. I haven't yet encountered very many people who actually use those pronouns. A lot of my gender non-binary, gender fluid friends and colleagues use they, them. I think it's perhaps just one of those ones where it's easier. But these are examples of the type of neopronouns that you might come across in the future. Now, we need to practice these. It's really important. There is absolutely no way you are going to get this right straight away, and there is no way that you're going to get it right if you don't have somebody in your life who uses a neopronoun that you can, in effect, practice on. Nor do you want to use that gender non-binary, gender fluid person in your life as your guinea pig. So in my family, we have gender non-binary teddy bears so that we can practice using they, them. So a lot of my daughter's teddy bears are they, them, and we practice or try to practice using non-gendered language. So we talk about snow people, for example, we talk about firefighters. We don't assume that something is male unless told otherwise, because you see that a lot. Oh, look at that horse, isn't he lovely? Why couldn't the horse be female? You know, these kind of things where we try really hard to practice using non-gendered language. And sometimes it comes across really clunkily, as I've said. Snow people is taking a while to catch on, but it's one that we're seeing a lot of at the moment. But that's the best way to help normalize using pronouns. And so this is why I, as somebody who is cisgender, I state my pronouns. I stated them at the BCA conference. I make sure they're on any marketing materials that go out. They're on my website. I always state my pronouns because it takes nothing away from me as a healthcare provider and as somebody who is cisgender. It doesn't cost me anything. It doesn't damage me in any way. It doesn't upset me. It doesn't distress me in any way to quickly put she, her on my, on my Zoom webinars or on my business cards or on my marketing materials. It barely even crosses my mind anymore. But for somebody who is gender non-binary, that can make a huge difference, and it can really, really open doors for people feeling more comfortable with you. I also have a sign on our door, which if you've done the course, you might have it already, the LGBTQ plus inclusive clinic. So we have this, and I cannot tell you, I probably have 5 or 6 patients a week who come to me because they know that we're in LGBTQ plus inclusive space. And they're the most fabulous people. I have one person called John who lives in a blended family. He's in a polyamorous relationship. He's bisexual. We put theatre show tunes on while he's having his treatment, and we just wax lyrical about the world, how it is nowadays. And for him, as somebody who has had a mental breakdown in the past, for him to be able to receive that kind of inclusive care, he's told me multiple times that it means the world to him and it's a safe space for him, and that he hasn't had that before. So it's incredibly, incredibly powerful. It is a really evolving landscape. So when I was talking about my earlier patient who was using they, them pronouns, is now using she, her pronouns, we have to allow space for our patients to change their pronouns, as many people who are gender fluid do. So some people will identify as a person who uses they, them pronouns one week, and then they might say, actually, I feel more female this week and I'm going to use she, her pronouns. Demi Lovato, for example, as an example, I think she started off using she, her pronouns. I think they then changed to using they, them pronouns. And I think they have now changed back to using she, her pronouns. I believe, I could be wrong because my pop culture isn't great, but as somebody who's used neopronouns on a very public platform, it's one that I keep a little eye on. And there's, again, people can find it really, really difficult because it's really hard to then be like, oh, she was she, her last week, they're now they, them. Oh gosh, like, do I need to ask them each time they come in? No, because hopefully by that point, the patient has got to the point where they're comfortable with you to tell you what pronouns they're using, or to say, oh, actually, nah, do you know what? I'm going to use she, her going forwards. So in terms of the legal context around using pronouns, because this is one that people ask a lot about as well, particularly when we're looking at clinic policies and processes, and we're looking at whether a clinic is compliant with things like the Equality Act, for example, which as healthcare providers, we do have to be compliant with. There is no legal requirement to ask for pronouns. It is also not something that you can overtly claim as discriminatory to not use somebody's correct pronouns. However, as healthcare providers, we have a legal duty, particularly if you're a healthcare provider working within the NHS, you have a legal duty to reduce these health inequalities and to try to take action against health inequalities experienced by people from minoritized groups. And so whilst gender reassignment is protected under the Equality Act, gender identity isn't explicitly. However, if you're interested, there is a case, Taylor versus Land Rover, was it Jaguar Land Rover? Taylor versus Jaguar Land Rover was a bit of a landmark case where the complainant was somebody called Taylor. They were gender fluid. And so they experienced horrendous discrimination from their colleagues, name calling, microaggression, microassaults, and they were eventually awarded £180,000 in damages after taking this forward. And the court did rule that somebody's gender identity is an extension of the gender reassignment protected characteristic. And so if you have a patient where you are repeatedly misgendering them, where you perhaps don't have inclusive policies or practices in place within your clinic, as Jaguar Land Rover didn't, as a massive employer, that was one of the things that I think was most shocking about the case, was that HR didn't have any guidance. There was no guidance on transitioning at work for this person. And so it became a much bigger issue. And you might be thinking, well, I just work in a small clinic and that's not an issue, but a patient would still be able to take forward a complaint against you if they felt that the discrimination that they were receiving was linked to their gender identity. So whilst I try to stay away from using the business case for EDI because I just think it's really cheap. I think that we're healthcare providers and we should want to do good for our patients, and not just because if you see one person from the LGBTQ plus community, you do a good job, they'll refer your friends. Like, yay, that's great and that's wonderful, but I want to do it because I think it's the right thing to do. But so we don't have a legal duty to use somebody's pronouns, but we do have a moral and an ethical one. And I think as ethical evidence informed practitioners, it's something that I would hope that we're all looking to do. So, oops, I did it again. I was having fun with this one. It could have been the cold and flu drugs, but I thought it was fun. So what happens if you make a mistake, if you use the wrong pronoun with somebody? Now what? What do you do? The simplest thing and the most straightforward thing is just to apologise and move on. As I mentioned earlier with that situation with my daughter's enrolment forms for her school, somebody who is misgendered, the amount of times that you will see them apologise and say, oh, I'm sorry, like, I know it's difficult, you're having to change your forms for me, or oh, sorry, I know this is really awkward, but actually I use they, them pronouns. There's no option for me to fill that in on your form. They're having to apologise and they shouldn't be put in that position. So if you make a mistake and if you misgender somebody and you say, oh, Mr. So-and-so's in reception, he's here for his appointment, and they say, actually, I use they, them pronouns and I'm not Mr., just apologise. I'm ever so sorry, I used the wrong pronoun, I'm learning, I'm going to do better in the future, and then move on and try not to do it again. This is where it becomes an issue. If it's something where, oops, I did it again. If you keep doing it again and again and again, it becomes an issue and we need to try harder. But perhaps look at ways that you can put safeguards in place to ensure that you don't misgender that patient. So Jane App, excuse me, sniffing. Jane App, for example, has a way that you can display their pronouns on the top of their intake forms. So I can see those. I can also see them on the patient's chart. And it also helps me just in the at the top of their charts where you can put like a medical alert and things like that. I will often use that not just for medical alerts, but also for information about that patient. So if I've got somebody who is transitioning and they are thinking about going through surgery, or they're thinking about having some kind of gender affirming hormone therapy, that's where I will put that information, just so that I can keep an eye on that, ask about the information, see if anything's changed. And it also keeps that prevalent in my mind, because you would be perhaps not shocked, but you would be amazed at the amount of people who pass incredibly, incredibly well in their new gender, in their affirmed gender, and you wouldn't necessarily know that they were a transgender male or a transgender female. So we all make mistakes. I think that's the point that I'm getting at here, is that we do all make mistakes. You are going to misgender people. You are going to use the incorrect pronouns. And that's not to say that that you're failing in any way. It's very, very human. We do it all the time. It is a microaggression, though. So we do need to try hard, but we also need to accept that the mistakes will happen. But as with any mistake, apologize, move on, try and do better in the future. You can also, there's been instances, for example, I was at a conference last year, which was the NHS LGBT conference, and somebody was repeatedly misgendering another person when they were talking about them in practice. So they were talking about them in the conversation, the person wasn't there, but they were using an incorrect pronoun with that person. And so in those situations, I always pull that person aside and say, I don't know if you're aware, but the person that you were talking about uses they, them pronouns. And so you can just gently inform them without humiliating them publicly, without saying to your receptionist in the middle of reception in front of five other patients and say, this person uses they, them pronouns. You can just pull them aside and say, just a gentle reminder, this patient uses they, them pronouns. I notice you are misgendering them. What can we do to help ensure that you remember in the future? And put those plans in place, because it's not just about us as practitioners, right? Our patients have experiences with other members of our team before they even come into our clinic, before they come into our treatment room. So I'm going to leave a few minutes at the end for questions in case there are any, but in terms of next steps, in terms of things that you might want to do going forwards, we do have, as I've mentioned, our LGBTQ plus inclusive course, and I've put a little Merry Christmas discount code for you, which is only valid until tomorrow. So if you want to scan and use that code of Xmas15, that will give you a 15% discount on that course. It is 10 hours of CPD. It's quite an extensive course, but it covers everything that we would hope that people would need to know about providing LGBTQ plus inclusive care. So it is everything from a better understanding of the background of LGBTQ plus inclusive care, a deeper dive into the health experiences that your LGBTQ plus patients have, talking about the pathologies and the conditions that are more prevalent in this group and why, backing up with the statistics and the science, talking you through the various surgeries that your patients may or may not have, the impact that can have on the body. So we talk about phalloplasties and the types of where they take skin flaps from, for example, the nerves that are involved, how that might impact your patient's response to care, how that might impact future things that they might present with. For example, some of the surgeries, just as a little tidbit, one of the surgeries for phalloplasty involves the lateral femoral cutaneous nerve. So we get people thinking about, if the lateral femoral cutaneous nerve has been resected, what would you do if you were looking for a patient who you're concerned has a lower leg issue, for example, and they've had that surgery. So it takes you through that, as well as inclusive intake forms, as well as better guidance, signposting for your patients, talking about the hormones involved in the transitioning journey for your patients. So it's incredibly comprehensive. And then next year, during Pride Month, we do have a hands-on training course as well, where myself and Anna, the co-author, are going to be taking you through a hands-on approach to manual care for LGBTQ plus inclusive patients. So an inclusive examination, and inclusive hands-on care with practical demonstrations. So that's your next steps from there. We do also, if you're working in a clinic with administrative staff, we do also have a number of short courses that are LGBTQ plus inclusive care for non-clinical staff. So helping your reception staff, for example, build a better understanding of pronouns and why you're suddenly asking them to start using their pronouns, for example, or start asking about pronouns, or why you're changing up your intake forms to include it. So really helping to bring the team along with what you're doing. So I hope that's useful for you, and do scan that, make sure that you use the coupon code.